Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today I'd like to welcome our guest, Sunita from the United States, who takes LDN for fibromyalgia, depression, dry eye and dry mouth. Thank you for joining us today, Sunita.
Thank you for having me.
Could you tell us, when did your journey start?
End of 2013, I was actually seriously ill. I had a lot of issues going on. I had breast implants that were making me sick. I was living in a house with toxic. Realized were the things that was causing me issues. But few years after having a lot of struggle with my health, I happened to read an article on hypothyroid mom about LDN, and I decided to give it a try. I had started to detox, and I was on the right path. However, I was still not completely better. I couldn't wear my contacts for a couple of years. My mouth was so dry. I was just not getting diagnosed either. I just knew like what the symptoms were, but I was not getting any help from any of the doctors, unfortunately.
Mm-hmm. So what tests did you have to establish a diagnosis?
To be honest, I might have seen about 15, 20 different doctors, and only a couple of them really did help me with my diagnosis. Most of them told me nothing was wrong with me. So fibromyalgia, I think it's easy to diagnose. They just press a few different points, and they say you have fibro. There's nothing really. There's no medical test for that. But the pain was real, for me. But for me, LDN was a godsend because just a couple of doses, and my eyes had tears in them. My dry mouth was gone. My depression was completely lifted. I have hypothyroidism also, and I feel it helps that also on some level. And fibromyalgia also completely gone. Like, I don't even mention to the doctors anymore that I have fibromyalgia, So
you were saying, I'm trying to work out here in my head. So you've got thyroid issues, and the thyroid issues could be probably Sjogrn syndrome, maybe. Has anybody ever mentioned that?
Yes.
Because the dry
right.
eye. Yeah.
Yes. Nobody diagnosed me really, but like, you have to be your own health advocate, right? That's how I was able to get to even finding about LDN. It wasn't through the doctors, which it really should have been, but that's what I was thinking. That I don't know how to say it, but Sjorgens. I felt that, right? That's what I also had. My toes used to turn blue. I had like, maybe that was Raynaud's, like a whole bunch of things. But again, living in toxic mold and continuing to live in that environment, it was really destroying my health. So.
Are you still in the toxic environment at the moment?
No, I left 8 years ago. I left the house with nothing. Like, I didn't take anything with me. Only the clothes that I was wearing, and those I threw away later. And then my journey began. I actually have started my youngest son on LDN last month too, for OCD. So it's helping him a lot too.
Okay. And how old is he?
He's 16.
Mm-hmm. Okay.
Mm-hmm.
Yes. Sjogren syndrome is treated by rheumatologists. So obviously rheumatologists, the pain aspect that you're suffering and the dry eyes.
Yes.
But if you're on the right path now, it doesn't matter, does it?
It doesn't.
No.
Yeah.
So could you give us a typical day for you prior to starting the treatment that put you on the road to good health?
Oh, I mean, I was in such a bad physical shape that I couldn't even walk up the steps. I had trouble breathing. The dry eyes and the dry mouth was so bad. Like no matter how much water I drank, it stayed dry, and it was affecting my dental health too. I had hair loss, and I had like a lot of these red freckles in my eyes. Um, I had to. I used to wear contacts all the time, but I had to wear glasses continuously for a few years. But I couldn't get through the day. It was so hard for me. I was on all kinds of medications, antidepressants, sleeping medicines, Ambien, something for waking me up, Adderall. I was, I had ADHD also. So I think I was able to get off of all those medications just by starting LDN. I couldn't get out of bed. I used to wake up like 4 a.m. Almost every day. So just couldn't figure out what was going on, what was wrong.
Mm-hmm.
Yeah.
So when you started LDN, did you notice any side effects?
Just the first couple of nights, I had vivid dreams. Those went away, but after some time, I noticed I couldn't sleep, so I switched taking it to morning, and I have no problem sleeping.
Mm-hmm.
I think for some people, it just works better that way. Again, joining the group, asking questions there, that's what helped me really. Even like increasing the doses, and I didn't know like what I needed to do. Luckily, I had a good doctor who did prescribe it for me. So once I had the prescription, and even after I moved states 7 years ago, I was able to continue because luckily I got another good doctor who was willing to, even though he wasn't sure what LDN is or what it does. He had faith in me.
I think I've lost the sound again. Can you hear
Sorry,
me?
I
That's
can
okay.
hear you.
Good. Okay. So how long did it take when you first started to take LDN to get to where you are today? What did that look like?
Within a few days, my dry mouth was gone, my dry eyes, those things were so instant that I noticed. And it helped my pain, I would say within a week. I didn't need to take any pain medicines. Um, and Between that and then my thyroid medicine. So I got off of all these other medications, and now I was just on LDN and my thyroid medicine. And most importantly, I forgot to mention this. I was able to eat gluten. Before I couldn't. I had to be on this gluten-free diet. It was really hard, actually. You know, just for myself, I would have to worry about, I had to give up gluten. I had even yeast. I had yeast overgrowth. I had to give up fruits, sugar from the fruits, everything. So my diet was very limited. But after LDN, I was able to digest gluten, no problems at all. I haven't looked back,
Right.
at all. So, and
So
I don't plan to stop taking it ever. I do skip it once a week, um, usually Saturdays, but, other than that, no issues.
fantastic. Well, thank you very much for sharing your experience with us today.
Thank you. Thank you for having me.
Okay. Bye-bye.
Bye.
What would you put on a comprehensive list of mast cell inhibitors?
Well, step one therapy is been reviewed. Is that what you want to hear about? The H1 blocker, H2 blocker, flavonoids. I'm using more luteolin, liposomal luteolin, and it seems to be a hit. Also, vitamin C and D are mast cell blockers, and LDN, I think, if it wasn't addressed, I might have missed it, helps decrease the T cell, B cell, and mast cell activation. There are receptors on the mast cell whereby the toll receptor will be blocked by naltrexone per se. And if you knock down the cytokines, you're decreasing the stimulation of the mast cell. So those are my thoughts.
Is there a method to slowly introduce new foods?
typically, it's again has to be very individualized. You introduce one thing at a time. You would work with your medical professional to try to decide what food makes the most sense to try next. And I think that depends on what your base of foods are. Let's just say you'll have 3 foods, and one is a vegetable, one is a meat, and one is something else, right? So you have to figure out what is the next thing you're trying. Are you going to try another animal protein because you want to try to get your protein up? Or is that going to be more problematic because it seems like you're more reactive to animal protein? So now, you need to try a different type of vegetable. So I think some of it is trying to figure out what is the food that's going to make the most sense to trial next based on what you're already eating and what you need more of. And then, it could be, you might try this new food. You're going to try, sometimes just like a bite. You're going to make sure there's no other ingredients mixed in it. Maybe you do okay with the bite today. So maybe tomorrow you can take 2 bites. Some patients have to go exquisitely slowly on that process. But I think that's something that has to be individualized with you and, a medical practitioner.
What do we want to treat, the chicken or the egg? So if the disease is due to MCAS, then we need to treat that because they won't tolerate the drugs. And that was shown in Dr. Blitzen's and my paper in November 23, looking at just a case series of patients, of good patients, to demonstrate changes who failed psych therapies. Then they were seen by me or Svetlana in Buffalo, and then we diagnosed them with MCAS, treated them for MCAS, and they got better. One of these patients, who's presented as a patient who exemplified such qualities, was treated for refractory GI symptoms with hydroxyurea, and this drug, which is normally used for various conditions, but mostly hematological disorder, got better. Not only did her GI symptoms got better, but she called me up and say, should it work on my depression? Because I've had lifelong depression and had suicidal thoughts every day, and now I don't. So just with aggressive therapy for MCAS, she got a lot better in the brain. So that exemplifies what we've talked about earlier, that these mediators go across leaky barriers, including the blood-brain barrier and the gut barrier, and that causes havoc in our system. I'm Dr. Leonard Weinstock, a guy who's been prescribing LDN since 2005, and I've seen the wonders. And I keep on seeing them, especially in hard to diagnose conditions. They're not that hard to do, but once you know about mast cell activation syndrome, postural orthostatic tachycardia syndrome, and Ehlers-Danlos syndrome, you'll find that 17% of your friends or relatives have one or more of these conditions, and you can help them. We're making a documentary to wake up the medical community, to educate the population, but we need funding. So please fund whatever you can afford, no matter how little. www.mcasfund.com. That's mcasfund.com.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.